Good morning, everyone. This is Rebecca Strauss from Miller Johnson here with my friend and colleague, Sarah Willey. Sarah, how are you this morning?
I am wonderful. Good
Good.
to talk to you.
Yes, you too, and welcome to everyone who is joining us this morning. For those of you who were at the Fall Client Seminar yesterday, it started at 9, it has been less than 24 hours since I spoke to you. So I hope you missed me as much as I missed all of you. I am very excited for today's webinar because today's webinar is like getting the answer key for the test, right? You've read all the rules and laws, you've listened to our other webinars that go through them paragraph by paragraph, but today we are giving you the answer key for the most common scenarios you are facing and just telling you when employees have to stay home, when they can return to work, what type of leave protections they are entitled to under various scenarios. We're first going to talk about how long an employee has to isolate or quarantine. And before we give you the answers on that, we want to make sure that we're all on the same page regarding the word choices we're using and the terminology that we're becoming more and more familiar with as we're all living with COVID-19 longer and longer. The term isolate means employees who have tested positive for COVID-19 or have the primary symptoms. Okay, so when the employee is positive or has symptoms, they isolate. Quarantine refers to close contact. Okay, so employees who have had close contact with a person who has tested positive for COVID-19 or has symptoms. Okay, so those are the ways we are going to be using the words in this webinar, and those are the ways the CDC and others use those terms. We are going to be talking to you about when employees are entitled to pay as well as job protection when they're isolating or quarantining, and we are going to apply all of the relevant state and federal laws to that analysis. As I mentioned at the beginning, we are not going through each one of these laws paragraph by paragraph on this webinar. We have other webinars that go into great detail on these statutes. And if you want to geek out on that, you are welcome to go back and listen to those. They're all on our website. Today, we are applying them. We are going to apply them to 4 different scenarios. We are also going to take your questions. Some of you sent in questions ahead of time, which was very helpful. You can use the Q&A function during the Zoom call. We will probably not be able to answer every single question, but we'll get to as many as we can. The questions that we are starting off with are these 4. We're going to talk about first when an employee tests positive for COVID-19, but is asymptomatic, has no symptoms. 2, when an employee has primary symptoms of COVID-19, but has not been tested or the test came back negative. 3, when an employee tests positive for COVID-19 and has symptoms. And 4, when an employee has close contact with a person with COVID-19 or primary symptoms. And the example we're going to use in 4 is specifically an example involving spouses. We received several questions ahead of the webinar regarding spouses. So if you asked one of those questions, hang in there to scenario number 4. We will be ending the webinar at 9 o'clock. That was one of the questions we got. Will this end at 9? Yes, but if something goes haywire for some reason, one of us is still talking at 9, have no fear. Our webinars are all available on our website. You can always go back and listen to the end that you missed, and they're also on our resource center. Okay, with that, let's jump in to scenario number 1, which is an employee testing positive for COVID-19, but is asymptomatic. Okay, so scenario number.
Thanks, Rebecca. Yep. Thank you for that fantastic introduction. I appreciate it. this is Sarah talking now, and I will walk you through each of the scenarios. Rebecca and I gave it careful thought and came up with all of these situations for which we have been getting lots and lots of questions over the past several weeks. And by the way, I feel like we go through different themes of workplace concerns in COVID times. And right now, I would say we are living the theme of how long does my employee have to isolate or quarantine? I'm just getting lots and lots of questions about that, okay? So let's take scenario one. I think, quite frankly, it's the easiest one, okay? Sarah took a COVID test for her upcoming trip to Hawaii, right? Laugh out loud. She naively thought she was going to get on an airplane and travel to someplace fun right now in the middle of the pandemic. As she was packing her bags, she got the results, and oh no, it's positive. She feels fine, has no idea when she might have been exposed, and she wants to come back to work and promises to wear a mask at all times and not get within 6 feet of anyone. She even says she can get a note from her doctor saying that she is fine, okay? So in this scenario, like the others, what we're going to do first is talk through whether Sarah can come to work, right? What are the isolation or quarantine requirements first? And then the next slides are going to be, does she have job protection and pay during those times? Okay, so step one, what are Sarah's isolation requirements now that she has a positive test? Okay, and there are 4 places that we have to look at this point to answer that question. The first place is, what is our local health department going to require? What are they going to say to us and to Sarah about whether she can be in the workplace right now? And we do know our local health department is going to be looking to the CDC guidance within that regard, okay? We will also need to be looking at Public Act 238. That's the brand new law that Governor Whitmer signed last week, and Sandy Andre and I did a webinar on that on Monday. We will need to look at the Michigan Department of Health emergency order, and we will need to look at the MIOSHA emergency rules. Goodness sakes, take a deep breath, right? So that's where we sit, okay? So as we apply those 4 things to this scenario, no question, CDC local health department will say Sarah should isolate for 10 days after the date of her positive test. Now remember, Sarah has no symptoms, so we don't need to use the analysis that involves 10 days since the symptoms began, fever-free, et cetera. Okay, it's just 10 days from the date of her positive test, and it's 10 days from when she took the test, not 10 days from when she got the results. Okay, so that's what the local health department will say. That is also what Public Act 238 says. Okay, Sarah shall not work for 10 days after the date of her positive test, and she gets job protection for that time. The Michigan Department of Health says Sarah cannot be present in a gathering at work until she is advised by a healthcare provider that she can return, or 10 days have passed since the test was administered. Now, this is interesting. As you can see, it's slightly different than what the local health department will say and what Public Act 238 says. And arguably, if Sarah goes and gets a note from her healthcare provider saying she can work, which, by the way, I think is highly unlikely, if she did, there could be an argument here that under that Michigan Department of Health emergency rule, Sarah could return. But the problem is that Michigan Department of Health emergency rule does not stand alone. Okay, so we still have to comply with Public Act 238. And so that doesn't matter. Her getting a note from her healthcare provider is not going to help her in this regard, because Public Act 238 still forbids her from working for 10 days after the date of her test. And then lastly, MIOSHA says she cannot work until she's no longer infectious according to CDC guidelines or release from the local health department, okay? So in this scenario, it is clear that at least 3 of these sources say Sarah has to isolate for 10 days after the date of her positive test. And almost certainly that's exactly what the health department is going to tell her to. So bad news for Sarah, even though she feels fine, she's got to sit on the bench for 10 days. What about, though, does she get job protection and pay during that time? Okay. Again, we have 4 sources that we have to look at to answer that question for each of these scenarios. The first one is Public Act 238 provides job protection whenever an employee is sitting on the bench or staying away from work for the reasons that fall under Public Act 238. So if you remember, in the previous slide, we said Public Act 238 requires Sarah not to work for 10 days after the date of her positive test, which means, of course, then she has job protection during those 10 days. You should not be counting those days under your attendance policy, okay? The second source we need to look at is whether Sarah has job protection and also pay under the emergency paid sick leave provision of the FFCRA. Now, this is an interesting question, and Rebecca and I had some fun talking through it yesterday afternoon, sort of debating it, because if you remember, the first qualifying reason for emergency paid sick leave under the FFCRA is if an individual is subject to a governmental quarantine or isolation order, okay? So the question then, of course, becomes, is Public Act 238 a governmental isolation and quarantine order? We think that there are arguments on both sides of that, okay? And without subjecting you to our lengthy discussion, here's how I would summarize it. Public Act 238 says a person shall not work, okay, and requires them to stay home from work, but it doesn't broadly say that they're not allowed to leave their homes, okay? Now, I think the intent is that it's an isolation order and a quarantine order and falls under the FFCRA as emergency paid sick leave. On the other hand, somebody could argue, well, it's not strictly an isolation or quarantine order because it only forbids that person from working and not leaving their home entirely, okay? So I think those it's difficult for Rebecca and I to give a black and white answer to a large group like this because it's going to depend largely on your organization in the situation as you guys decide how to apply that, okay? Now, obviously, erring on the side of being conservative and giving somebody that paid leave, the 10 days of paid time as emergency paid sick time is very low risk, right? You're giving an employee something rather than denying it. The risk would come though when you take the payroll tax deduction. If there was an IRS audit, okay, would the IRS agree with the reading that Public Act 238 is an isolation order, okay? The odds of that are very low, to be honest. On the other hand, right, if you're thinking of the risk of not providing employees emergency paid sick leave when they're home due to Public Act 238, right? Then you're looking at a lawsuit filed by the employee for failing to do that. It feels to us that the odds of that occurring are higher than the IRS auditing your payroll tax practices, okay? That was a very long answer, and I apologize for that. But that is the analysis there, okay? So in this case, Sarah will be home, mandated to be home. She has job protection under Public Act 238. She arguably has pay as emergency paid sick leave under the FFCRA. And of course, that also comes with job protection as well. And by the way, even if Public Act 238 is not an isolation order under the Emergency Paid Sick Leave Act, don't forget there are other qualifying reasons under that act as well. So it would also fall under the Emergency Paid Sick Leave provisions if Sarah was advised by a healthcare provider to stay home. Okay, so don't forget to look at all of the qualifying reasons under the Emergency Paid Sick Leave. Okay, third and fourth ones are easier. We also have the Michigan Paid Medical Leave Act. This would fall under that act as well, because one of the qualifying reasons for paid medical leave under the Emergency Paid Medical Leave Act is if it is determined by health authorities that an employee's presence in the community would jeopardize the health of others because of her exposure to a communicable disease, then that person can use their paid sick leave for that reason. And then finally, the fourth box we have to check is the FMLA. That's an easy one here. The FMLA would not apply to this situation because Sarah is not incapacitated. Okay, so that's the summary for the first scenario, a positive test, no symptoms. I'm going to pause there. Rebecca, do we have any questions at this point that we can cover before we move on to the second scenario?
Oh, we sure do, Sarah.
I thoroughly confused everyone, huh?
Did you think I was going to say no?
I did not.
Okay, let's ask one that, frankly, I've gotten some client calls in, came in before the webinar, and now has been asked during the webinar. So I am going to ask it somewhat generally.
Okay.
It has to do with the concept of an essential employee, right? Which was a primary concept we all wrestled with, right? Critical infrastructure employees, essential employees. Back in March, April, May, we all had to make those decisions. How does the fact that an employee is an essential employee impact your analysis at all, if at all?
Yeah, so it really doesn't for this first scenario. And let me explain, and then I will also more directly say whether that continues to matter at all anymore. So back in the spring, the CDC published some guidance talking about certain employees being able to return after they've been in close contact with a person who has been confirmed to have COVID. Okay, so that's really our fourth scenario that we're going to be talking about. And what the CDC said is, look, if we're talking about an employee that we really desperately need to be working right now, right, is in the one of our critical infrastructure employees, then they don't necessarily have to sit home for 14 days. They could come back to work sooner under certain circumstances. Okay, now again, that's not an analysis that the CDC ever said would apply to somebody with a positive test. And the CDC's recommendations continue to say that. Our problem, though, is that Public Act 238 largely does not follow that analysis, nor does the MIOSHA emergency order or Michigan Department of Health order apply it either. Okay, so in Michigan, that really, the CDC's guidance in that regard is not going to influence whether we can let somebody come back to work sooner. Now, the one thing I will say, and I talked about this on Monday with regard to Public Act 238. Public Act 238 does have certain exceptions to the close contact quarantine requirements for certain employees. Now, that's much narrower than the CDC's application to all critical infrastructure employees. In Public Act 238, they talk about healthcare employees, first responders, correctional facility employees, folks working in adult foster homes, et cetera. Okay?
Got it. That is extremely helpful. Thank you. One more quick question before we move on to scenario 2. Is an employer required to pay someone who is awaiting a test and it comes back negative?
So it depends, right? It depends on whether they have symptoms, right? So it depends on whether the reason that they got the test in the first place, number one, falls into a category under Public Act 238, right? Because remember, anybody with the primary symptoms of COVID falls under Public Act 238. So if I got a test because I have a fever, then it would arguably, right? Because don't forget, Public Act 238 arguably is a governmental quarantine or isolation order. It also could apply if you had close contact, if you're getting a test because you had close contact with a confirmed case. If you just went to get a test for the fun of it, right, just for kicks, you were just kind of curious,
Yeah.
right? I'm just curious, do I have COVID, right? And it came back negative. I can't imagine, that would not fall under any of the qualifying reasons for emergency paid sick leave.
Got it. Thank you. Okay, with that, let's move along to scenario 2.
Excellent. Okay, well, scenario 2 is, right, in this case, it's sort of the opposite of what we had in scenario 1. In this case, we have an employee has symptoms of COVID, but has not been tested, or then tested negative. Okay, so employee has symptoms but has not been tested, or thereafter, or did get tested and thereafter tested negative. So that's sort of maybe the situation you were asking in your second question there. Okay, so let's put it into context with our actor Sarah. When Sarah arrives at work today, she has a fever of 101 degrees and is sent home. Probably some of our listeners lived through situations like this already. Sarah does not get tested at first, but then finally does a few days later, right? Maybe Sarah was thinking, I think I just have a bug. I'm not going to go get a COVID test, but she doesn't get better. And then finally, a few days later, she gets tested. A few days after that, her test comes back negative. Oh my goodness, we're getting in murky waters, right, guys? So you're thinking, all right, I don't know when she can come back. Her test is negative now, etc. Okay, so let's talk first about isolation requirements. And let me be clear, having a fever is a primary symptom of COVID, according to the CDC, according to Public Act 238, according to the Michigan Department of Health order, okay? So having a fever alone is a primary symptom of COVID. And if you're not familiar with the primary symptoms of COVID under Public Act 238, I'll just tell you those quickly now so that we have the right frame of reference, right? Under Public Act 238, the primary symptoms are one of these: fever, shortness of breath, or uncontrolled cough. So any one of those alone, or two or more of these not explained by some other medical or physical condition: abdominal pain, diarrhea, loss of taste or smell, muscle aches, severe headache, sore throat, or vomiting. Okay. So in this case, I wrote it to be clear: Sarah has a primary symptom of COVID. Okay. According to the CDC and what the local health department is almost certainly going to tell Sarah, Sarah has to isolate until all of the following are true: 10 days after her symptoms began, 24 hours fever-free without medication, and improvement of other symptoms. Okay, now here's the kicker: that negative test has no impact on that, and the CDC is very clear about that. The reason is because we're seeing just quite a bit of false negative tests, or individuals testing negative initially and then having it come back positive later. Okay, so that doesn't matter. Public Act 238 says the same thing. Because she had a primary symptom, she is supposed to stay home from work. She's required to stay home from work until all of those three things are true. Again, Public Act 238 doesn't let her out because she got the negative test. The Michigan Department of Health order says Sarah must not be present in a gathering at work until she's advised by a healthcare provider that she can return, or follow CDC guidance. We know what that says. She's sitting home. And again, under that order, there's this odd statement that arguably the Michigan Department of Health and Human Services might think she could come back if a healthcare provider says it's okay. Her problem, though, is going to be that the local health department is not saying that. And also, Public Act 238 is legislation that mandates she stay home. MIOSHA says she can't work until she's no longer infectious, according to CDC guidelines, or she's released by a local health department. So in this case, it's pretty clear Sarah's going to be sitting home for at least 10 days since her symptoms began, and also she has to have been fever-free, and other symptoms have to improve before she comes back. And I know it's counterintuitive that the fact that she got a negative test does not help her out with that, does not help her come back to work sooner. So let's talk again about job protection and pay. What does that mean for Sarah during that time she's home? This does fall under Public Act 238, which again means she has job protection for that whole time she's sitting home. Okay. Now, I will tell you, Public Act 238 does have a window by which an employer can request an employee to be tested. And if they fail to do that within 3 days, then they lose the protection of Public Act 238. So in this case, Sarah's employer, the minute she had a fever, could have said to her, you need to go get tested. And if she had failed to do that, then she could have lost the protection of Public Act 238. Okay. It arguably, again, because it falls under Public Act 238, it arguably also qualifies for emergency paid sick leave under the FFCRA. Even if not, though, Sarah would still get emergency paid sick leave if she were seeking a diagnosis or had been advised by a healthcare provider to stay home, right? So if she had gone home that day and called her doctor and said, I have a fever, what should I do? And the doctor said, you need to isolate for now and go get tested, then even notwithstanding the application of Public Act 238, she would get emergency paid sick leave for her time off work. It also falls under the Michigan Paid Medical Leave Act, both because she's sick, right? So if you remember, that act defines illness very broadly, and in this case, she had a fever, and so it would fall under that. And also for the same reason that the first scenario falls under the Michigan Paid Medical Leave Act. And then finally, the FMLA could apply here. Of course, it would depend on how sick Sarah is and how long she was actually incapacitated from working, just like is the case whenever we have employees with bugs and viruses, et cetera, right? So if she were inpatient, if things went really downhill for Sarah and she ended up in the hospital overnight, the FMLA would apply. Also, if she's incapacitated from working for more than 3 full calendar days and sees a healthcare provider twice, or sees a healthcare provider once and gets a prescription, the FMLA could apply as well. If you want to just cut to the chase, right, cut off that loop right away, you could just send her the paperwork and give her the opportunity to fill that in if she wants to request FMLA leave. Okay, so let's pause there. I'm sure we have at least a couple more questions, Rebecca, and that'll help shed light on scenario 2. What do you got?
We sure do. And apologies again, we aren't going to be able to get to all the questions, but we are going to ask the ones that we think apply to lots and lots of clients. The first is, I think, a question on lots of people's minds. What if Sarah is able to work from home? How does that impact your analysis?
Oh, that is a great question, and that is something that I think we forget, right, to think about, and certainly could have applied in the first scenario too, right? In which case Sarah was feeling just fine, but it tested positive. If Sarah feels well enough to work from home and can work from home, she absolutely can do that. She just the isolation requirements just say she's not allowed in the workplace. They don't say she's not allowed to perform any work at all so long as she's isolating. So from the isolation requirement standpoint, that's perfectly fine. From the job protection and pay standpoint, I think the pay is going to be the more significant consideration here, right? If she's working from home, then we would obviously pay her for her work. How that looks is going to depend on whether she's exempt or non-exempt. And in that case, if she's getting paid to work, then the emergency paid sick leave would not apply, and we certainly wouldn't get the payroll tax deduction for paying Sarah to do her job. Now, there are also lots of thoughts and requirements about pay when somebody's working remotely that I'm not going to get into in this webinar today, but I know we've covered it in other webinars as well. The other thing I'll mention is I would be careful if Sarah says that she doesn't feel well enough to work or is not able to work because of her fever. You would definitely want to be careful there because she arguably has the protection not to work if she's too sick to work.
Sarah, can you remind everyone real quickly, which employers does the FFCRA cover? What size employers?
Oh, yeah, exactly, yes. So it applies to employers with fewer than 500 employees.
Someone asked the question, does it apply also to employers with fewer than 50?
Yes.
Yes, I was going to say, we are going to get into the nitty gritty of the FFCRA. There are some exceptions that you can try to fit into if you are a small employer, but you have to fit into, it's basically an undue hardship type of exception. You should assume if you're under 500 employees that you are covered by the FFCRA.
Yep.
Okay, let's do I'm going to ask you two at the same time, if you don't mind. This is going to be like, can I stump? Can I stump Sarah?
Okay. Final exam time. Got it.
These are the games we play during COVID times. They both have to do with kind of like the order of when and how much total leave time you get when you're thinking about the FFCRA and other types of leaves. So one question is, does FFCRA pay apply first, then MPMLA? That's always a tongue twister. MPMLA, in the event the employee has already exhausted 80 hours of FFCRA. And the other question is similar. Under FFCRA, the max is 10 days of pay. What if she has a second positive test after she was already paid for 10 days and it's positive again? So it goes to the total amount available under FFCRA and the interplay with that and the MPMLA.
Right. Yep. Okay. So I think it makes sense to take the second question first, and it's a total of 10 days or 80 hours for the employee. It doesn't restart every time they have a new qualifying reason to take it. Thank goodness, right? And so it's one pot, sort of like we think of FMLA, right? Employees have one pot of FMLA leave for all the myriad of reasons they might want to utilize FMLA. With regard to the order, I think in almost all circumstances, the emergency paid sick leave is going to apply first, and then available time under the Michigan Paid Medical Leave Act. And the reason I say that is because most employers are providing are complying with the MPMLA through some sort of sick time or PTO policy. And the emergency paid sick leave regs say that you can't layer those on top of each other. You can't layer emergency paid sick leave on top of other paid time available. Okay, so I would apply emergency paid sick leave first and then apply whatever entitlement an employee has from their 40 hours of time under the Michigan Paid Medical Leave Act. Rebecca, do you have anything to add to that, or do you have additional thoughts on that?
I completely agree with you. I think that the emergency paid sick leave under the FFCRA is, as Sarah mentioned, is crystal clear in the regs that it is to be in addition to other paid leave programs. So use FFCRA first and then flip to your other paid leave programs, whether it's PTO or whether you have established a separate MPMLA leave bank. Yep. Okay. We have lots of more questions, but let's move on to scenario 3, and we will pause.
Scenario 3. All right. So 2 down, 2 to go. So in scenario 3, we have an employee who tested positive for COVID and has symptoms. Okay, so again, remember scenario 1 was I tested positive, no symptoms. Scenario 2 was I have symptoms, but I either didn't get tested or I tested negative. Now scenario 3 is I tested positive and I have symptoms. When the heck can I come back to work? Okay, so again, let's put it in context. Sarah was still not feeling well and took a second COVID test. This time it was positive. And you guys, I am not making this stuff up because this has been happening. Employees have symptoms and they are home, then they get tested and it's negative, and then they get tested again and it's positive. Okay. And by the way, sadly, Sarah did, in case you're wondering, cancel her trip to Hawaii. Okay. So in this case, Sarah had symptoms. It was negative at first. Now she has a positive test, which adds a wrinkle. Okay. Again, let's look at the isolation requirements. The first, the CDC and our local health department say that Sarah has to isolate until all of the following are true. And what's changed here is under number 1, it's the later of 10 days after her symptoms began or 10 days after the positive test. So in this case, poor Sarah's been sitting at home already for several days. She waited a few days to get tested, and then she got it back and it was negative, but she still couldn't come back to work. And now maybe a week later, maybe even 9 days later, her test is positive. She is home for another 10 days, okay? That is also true, same analysis under Public Act 238. It's the later of 10 days after her symptoms began or 10 days after the positive test. And then, of course, you still have to satisfy 2 and 3, the 24 hours fever-free and improvement of other symptoms. The Michigan Department of Health order says she can't be present it's the same application, right? She can't be present in a gathering at work until her healthcare provider says it's okay, or following CDC guidance. So even if Sarah gets a note from her doctor, she's still going to be handcuffed by likely the local health department and also Public Act 238. She will also be handcuffed by the MIOSHA rules, emergency rules, that says she has to follow CDC guidelines and be released by the local health department. We are really across the board seeing local health departments telling anybody that they have to stay home for 10 days after a positive test. Again, that goes back to the date of the test, not the date you got the results. Okay, so what about my job protection and pay for that time? Sarah will get job protection under Public Act 238 for this whole time she's off work, because now she's off for another reason that falls under Public Act 238, which is that she's tested positive for COVID. Sarah can have access to emergency paid sick leave. She's now at a point at which she's probably going to burn through the 2 weeks and still be off work. But it would fall under that, again, assuming Public Act 238 is an isolation order. But even if it weren't, yes, if Sarah were seeking a diagnosis or was advised by a healthcare provider to stay home, given the facts as they've evolved, I think it's more and more likely that it would fall under not only arguably Category 1, but Category 2 as well, both of those bullet points. She could also have access to paid time under the Michigan Paid Medical Leave Act because she's sick, and also the health department is going to tell her she has to stay home because she has a communicable disease. And same analysis under the FMLA, right? She's now been sick for a while. She's had a fever. Let's not forget that the FMLA very likely could apply to her time off and give her that paperwork. Okay, so let's pause again. Do you have a question or two, Rebecca, that we can answer about scenario 3?
I do, and we've received several questions involving 2 themes. So I'm going to try to ask them a little more generally than they were typed in so that we can cover more questions. The first theme is the impact of these various laws based on the size of the employer. I think folks listening in want to make sure they know what applies to them and what doesn't. So specifically, a small employer under 50, which of these laws still applies to them and which do not?
Okay, so should we take them one by one? So Public Act 238 applies to any business with one or more, that employs one or more individuals.
Yep.
Okay, that's very, very broad. All of the MIOSHA emergency rules and the Michigan Department of Health emergency order and the CDC guidance don't make any distinction at all by size of employer. We talked about the FFCRA is less than 500. And Rebecca, you mentioned that there is that, right, a sort of undue hardship exception for very small employers, but assume it applies if you have fewer than 500. And the FMLA we know is 50 or more, as is the MPMLA.
Yeah, MPMLA.
Right. So bottom line, as we talk that through, the isolation and quarantine requirements do not have an exception for small employers. The MPMLA and FMLA do with regard to protection and pay.
Got it. Okay. Hopefully that answers everyone's questions on that. The next theme in the questions is about, again, the interaction between the different statutes. One question asks, for instance, if an employee has exhausted MPMLA, an employer is not covered by FFCRA, so this would be a larger employer.
Yep. Mm-hmm.
Their time off would be job protected under PA 238, but not any alternative pay option, correct?
Correct. Yeah, I think that's right. I think you'd want to think, I mean, if they're sick themselves, perhaps an STD policy or benefit could apply. And then, of course, if they've got available PTO, et cetera, they could utilize that if it was for a reason that falls under those policies. But that's right. I think they're thinking about that the right way. Okay,
one more on that theme, and then we'll move on to scenario 4, and we will have time after scenario 4 for more questions. Scenario 4, by the way, is about close contact, and we've got a lot of close contact questions.
Mm-hmm.
But for now, one more on this general theme. PA 238 doesn't increase or extend paid time beyond the 80 hours, correct? And I'm assuming that's the 80 hours under the FFCRA. We allow them to use PTO, which they also use for the MPMLA. There's just one bucket there. But most of our employees either do not have enough to cover it or do not want to use it.
Yeah, right. So Public Act 238 is job protection only, not pay. Okay, so if it falls under Public Act 238, it's job protection, just like you think about the FMLA, right? I get job protection, but it's otherwise unpaid. So if they've burned through their emergency paid sick leave and they don't have PTO to take, they have job protection for their time off, but that time off will be otherwise unpaid.
Got it. Okay, let's move on to scenario 4 because, as I mentioned, Sarah, there are a lot of questions about close contact cases. So let's go through the scenario and then some more questions after that.
Okay. So scenario 4 is the close contact question, right? My employee doesn't have symptoms and has not tested positive, but has been a close contact with a person either with COVID or primary symptoms of COVID, okay? And I think before we jump in, I do want to talk a minute about close contact and what that means, okay? We know it means being in contact with a person for at least 15 minutes. In contact, that means within 6 feet for at least 15 minutes. We also know the CDC just changed its definition to make clear those 15 minutes can be cumulative throughout a 24-hour period. They do not have to be in a row. And we have learned that is how MIOSHA intends to view close contact as well. And we have also learned that that's how the Michigan Department of Health and local health departments are likely to interpret that, the definition of close contact. Okay, so we're talking about total of 15 minutes within 6 feet of a person who has symptoms or has tested positive for COVID. Okay, so the best way to talk about this is to take Sarah out of it for a minute and say, Sarah's husband, Brian, is also your employee, right? And what do we know about him? Well, we know, presuming their marriage is going well, right? They're living in the same house, and we know Sarah has had symptoms of COVID and has now tested positive, okay? So Brian then is going to have quarantine requirements because he's been in contact with her. Here's what the CDC and the local health departments say. 14 days from Brian's last contact with Sarah will be his quarantine period. Now, interestingly, the CDC is applying those requirements just to somebody who actually is a confirmed case of COVID. Okay, so as soon as Sarah tested positive, the CDC would tell Brian, you have to quarantine for 14 days since your last contact with her. If Sarah doesn't have a space in her house in which she can effectively isolate herself from Brian, such that Brian's living in the same house with her is ongoing close contact, then Brian is going to have to sit out for Sarah's entire isolation period, right, which we know from the scenario 2 is 10 days from the date of her positive test, plus another 14 days. Now, with spouses, we're not seeing a lot of that because they're grown-ups and can do a decent job of isolating themselves so that we don't have that result. With children, that's more difficult, right? When you have an employee with a young child that's tested positive, the local health department is probably going to tell that employee they cannot work and they are supposed to quarantine for that child's entire isolation period plus another 14 days.
Sarah, let me just pause here again, only because we've received so many questions on this, particularly close contact with members in the same household. So that's where the questions are now. You mentioned there's themes, that have developed over the past 7 months.
Right.
This theme right now. So what you're saying is it would be a total amount of 24 days that the
Yes.
employee would not work in person, and let's make that caveat because of the earlier question, right? 24 days the employee could not come to work in person.
Correct. And that's if the order is, right, the member of the household, not the employee, but the member of the household is the one, right, that tested positive. Okay.
Got it. Thank you.
Okay. Now, for Public Act 238, Brian would have been required under Public Act 238 to quarantine when Sarah had symptoms, right? Because remember, Public Act 238 says you have to quarantine not only when you have close contact with a positive case, but even when you've had close contact with somebody with primary symptoms. So that day Sarah had a fever, right? Brian should have been quarantining, assuming he had been in contact with her, which I'm guessing he had, right, for 14 days starting from that point, okay? And also from when Sarah actually tested positive. Now, hopefully, when Sarah first had her fever, she isolated herself. So Brian had no further close contact with her after that point, okay? Just like the example I gave above, right? If Sarah immediately isolates herself, then Brian's 14 days can start from the last day of contact. If they continue to have close contact, then Brian's quarantine period is going to continue for up to that 24 days, okay? The Michigan Department of Health, again, says follow CDC local health department guidelines. We know what those are. And MIOSHA says Brian cannot work until he's no longer infectious, again, according to local CDC guidelines or released by a local health department. And we've gone over what that is. With regard to job protection and pay, it will fall under Public Act 238, which means Brian will have job protection for that entire quarantine period, whether it's 14 days or whether it's 24 days. If, assuming that Public Act 238 is an isolation order, Brian will have access to emergency paid sick leave during that time. He will also have access to his paid time under the Michigan Paid Medical Leave Act, assuming that the health authorities told him he needed to quarantine because his presence in the community would jeopardize the health of others. The FMLA would almost certainly not apply unless he was home also caring for Sarah, because she now has a serious health condition under the FMLA. But that, of course, would violate his quarantine requirements, so that's unlikely. And by that, I mean he's not supposed to be caring for her because he's not supposed to be in contact with her during that time. So unlikely that the FMLA would apply to that situation. So those are our slides. And we can take maybe one or two more questions before 9 here, but I just do want to, again, mention to everyone that we've got the COVID-19 Back to Resource Center. And for those of you who don't know, we have that resource center, as promised, has been entirely updated based on all of the changes that have occurred, particularly over the last couple of weeks. So the new legislation that's been passed, the new orders, et cetera. So if you're a subscriber, please go in and access the new and revised documents. If you are not a subscriber, go take a look at it because we think as we're scrambling and updating preparedness plans and figuring out what to do, it really is, in our view, the most efficient and cost-effective way to get the materials you guys need in order to comply. So, Rebecca, do you have one, maybe two more questions before 9?
Yep. Let me ask one that was asked several times here. The CDC's guidance or any other definition of close contact, does it matter if there was close contact, but both folks were wearing masks or had a plastic barrier between them?
Yeah. And I wish the answer were different to this, to be honest. And I just looked at this yesterday. The CDC says it does not matter. And that's counterintuitive to everything we're being told about wearing masks. I realize that. But as of now, they say it's a close contact even if both parties are wearing masks.
Okay. One last question. It's an FMLA question, and I know you love the FMLA. So
I do. Perfect place to end.
To you, Sarah, to end on an FMLA question. If an employee is under quarantine and caring for a minor child, I'm assuming the minor child is positive for COVID-19, does FMLA apply?
Sure, it could, right? Because don't forget, the FMLA can apply if you if you need it to care for a child with a serious health condition. So it would depend on whether the child is sick enough for to be considered a serious health condition under the FMLA, in which case the FMLA absolutely could apply.
So if the child is home because the child has had close contact at school, for instance, and the whole class was sent home, perhaps, the child would not have a serious health condition in that situation.
The child would not, but because we're in COVID times, we have to remember also that there's the emergency FMLA, right, that applies due to school closure. So if the entire school got shut down and the kid can't go to work because of that, don't forget we might need to look at whether the emergency FMLA provisions of the FFCRA might apply.
Perfect. It is 9 o'clock, so we will wrap up on that note. Thank you all. That's my phone alarm, by the way. Remind me to take my health assessment when I'm in the office. So hopefully all of your employees have reminders like that too. That's how I know it's 9 o'clock. So thank you all for attending today. It was good to connect with you all again. This is complicated stuff, lots of moving parts, lots of laws that may or may not apply to your organizations. Please let us know if we can help you further.
Absolutely. And stay well and stay safe. Yep. Have a wonderful day, everyone.
Bye-bye.
Bye-bye.